Dr. J.J.Kelly, thank you so much for being with me today. I appreciate it.
I appreciate it. Thank you.
Thank you. The topic that you have become an expert on speaks to a crisis in this country, clearly. Hundreds of thousands of teenagers who are self-harming, who are in crisis with mood disorders, emotionally out of control, having a lot of problems at school, a lot of antidepressant use, a lot of other illegal drug use. And obviously parents are beside themselves, not only those who have kids who are already acting out, but also those who are afraid of what's happening with their children and want to make sure they keep them on a healthy path.
Yeah.
You have become someone many parents are going to. What are the most important things for parents to know? What are the signs of an at-risk child? And what are the most important things for a parent to know once they feel that there might be something wrong?
Yeah. I always think that sooner's better than later. Get some help. It doesn't have to be from me, but get some help when you start to see personality shifts, which is really hard in adolescence because puberty is a personality shift. However, knowing what's normal, what's natural for that developmental phase, and what starts to get self-destructive, toxic, self-medicating.
So what are the kinds of changes? What is a factor? What is a line past which a parent, in your opinion, should say, okay, that's too much. That's not just within the purview of normal acting out as a teenager, and I need to seek professional guidance?
Self-harm for sure. That includes cutting of any kind, but it's more complex than that. If they're stealing your Xanax,
Yeah.
get some help.
Those are more
Um,
obvious. I think any parent who is really observant would know. What about food disorders?
oh, absolutely. Food restriction is very common, and a lot of them will grow out of it. I've watched them kind of phase out of that because, societally, particularly people assigned female at birth, all that skinny media is directed at them. So most of them go through a phase of that. However, if they start to learn skills to manage their emotions and build their self-confidence and reduce behaviors that cause shame, they just generally like themselves better and they don't go to shit like food restriction or alcohol poisoning, that some alcohol happens for high schoolers, but if they're getting hospitalized for alcohol poisoning, yeah, get some help. If their grades tank, get some help. I think grades tanking is the easiest way to identify something's really up.
Now, when you say get some help, a lot of
Mhm.
parents say, all right, I want to get some help. Where do I go?
Yeah.
Where does a parent go? I know
Yeah.
your books, holy shit, my kid is cutting the complete plan to stop self-harm. Also, holy shit, I'm a gifted misfit. I think that's a term that a lot of young people today can relate to. You put the young folks guide to unlock your superpowers. But before we get to the kid, we're dealing with the parent, of course. A parent knows something's wrong with my child. It doesn't feel right. A lot of parents say to me today, I went to the physician said I should put my child on drugs. I don't want to do that. Where does it, I know and I feel very strongly as well about that. Where is a parent to go today to seek the kind of help?
You know, it's limited, I think. Having been doing this the better part of 20 years, I think that efficacy in the mental health system is very limited. And so I have one person I will refer to in good conscience these days.
Okay.
So I
It's kind of
get
you or them.
what, pardon me?
It's kind of the two choices are you or them.
I mean, come to me. It's a free consultation anyway. You should
Okay.
at least try. If you can't deal with my personality, I'll send you to him because he's a lot more tempered. But if you're looking
Okay.
for someone in your area, which isn't even necessary now with
Right,
Zoom, but if
because
you
it's
want to do that, when we go back to in-person stuff, then when you talk to them, look for something just a little bit real, like authentic. It could even be a little bit off-putting because a parent is going to be nervous. Of course, this is super scary. They are just beside themselves with fear, so they're going to be really reactive when they're on the phone. So they might get triggered by something that the professional says, but don't discount that. They might be being themselves. And I think that's the most important thing when connecting, particularly with teenagers who can smell bullshit a mile away.
Well, that's the point, isn't it? What is sort of buttoned up and professional in the way that the parent wants might be the exact opposite of
Oh,
what
the
you
bane
need
of
to
my
do
existence, Marianne.
and what you were known for in your career, of course. The kids love you. You've got this kind of Johnny Appleseed thing. It's the kids who love. What is the key to your connection that makes teenagers adore you the way they do? What is this thing you have?
I have been asked that a lot and I don't have a great answer. I think it's that bullshit meter that they have, which I'm also known for. We have an instant connection because I'm real. I'm actually who I am. That's why I get to have flaws. I don't curb the swearing. I wear what I want. Nobody thinks a doctor's going to have tattoos. It doesn't matter. It's who I am. And when I bring who I am to the knowledge that I've gained in my education, and then I listen, I don't just tell them, do this, I'm the doctor, you're the patient,
Right.
listen to me and your whole life will be better, this doctor worship that goes on. I think that actually listening, not waiting to talk, but listening is an act of love
Of course.
and respect. And boy, they're hurting for respect. You remember what it was like to be a teenager? Nobody listened to anything you said.
Well, it's interesting though, because yes, when I was growing up, I wasn't listened to as deeply as I might have been. I wasn't given the respect I might have been, but I realized I was growing up in the 50s and 60s and my parents wouldn't have known better. I
Yeah.
know a lot of parents today who would say, I do listen to my kids and we do respect them and we've tried to do everything right.
Right.
It's not just children growing up with adverse childhood
Right.
circumstances that are in trouble these days. In fact,
Yes.
some of the girls who are considered most at risk come from affluent homes. What's
Yes.
going on in the culture? What's
Yeah.
happening?
Privilege. I mean, it's switched, right? It was not enough and now it might be too much. Like listening can border on enabling
Yeah,
too.
kind of hovering a little. Like
Yes.
every thought you think is so important.
Yes.
Yeah,
Yes.
I've
It's
seen
so
that experience too.
encouraged. And people want to do it the opposite of their parents, but I work with the Venn diagram, dialectics. We want both. It's not always the opposite thing works. It's an integration of what worked with something different as well. But I think the privilege thing is really interesting because having grown up poor myself, when I first started in Berkeley, I was like, oh, whatever, rich kid, real problems here, as a new greenhorn shrink. What I came to realize is that, especially with Oakland right here, these kids that come from privilege, they immediately invalidate all their problems because they think I'm supposed to be so goddamn grateful for everything. I'm not supposed to get to have problems, which I think is actually worse because it's so insidious. It's so hard to identify. And
Right,
they've got this built-in invalidation system.
right.
So sad.
That makes sense because they have a consciousness of social justice, which we appreciate, but no one really has a monopoly on suffering, and nobody's
Right,
suffering is really more important or less important than anyone else's. I
right.
totally understand that. So if a parent is going to you, obviously, if a parent has a child who's their self-harm or whatever, it's obvious this behavior's got to stop.
Yeah.
But when it's a more general thing, should a parent come to someone like yourself and think this is going to be open-ended? Or does a parent come to someone like you and think, well, this will be a 6-week or 3-month period? What should someone expect when they go to someone like you?
Yeah, having done psychotherapy and groups and psychoeducation for like 17 years, I have switched it out. I think there's a dependency there, when I'm seeing them year after year and the parents just, they're happy about it because they get better. I think that teaching the emotional intelligence skills in this 8-week beginner program, I can see definitive progress in that amount of time, and then they're not like dependent on me forever.
Going forward?
They can move up into an intermediate, and I have the advanced students that used to be the psychotherapy participants who are now teaching and learning the skills in order to teach them, which is thrilling. However, a lot of them just do the 8-week course and then they leave with the skills that they can use forever. I mean, my dream is that it's taught, I get to teach it in schools and get ahead of all the diagnoses,
Yes.
all the meds. Why aren't we preventative on emotional intelligence?
I couldn't agree with you more. And I think a lot of people are having the conversation now. And now, how do we operationalize all that? I have
Yeah.
one last major question for you. What about the difference between boys and girls? What do you see out there?
It's interesting. And as gender fluidity starts to happen,
Yes,
and
yes.
there isn't any gender at all, I would say there are some biological differences in wiring, but that between a male and a female animal, but in general, they all kind of work together. And that, masculine energy, feminine energy, that dialectic, we work with that as well. And any of the boys who are, or people who identify as boys that join our group, they're so strong because most of them are women or people that don't identify with a gender, and they do not put up with male fragility or male privilege or any of that. So there is this younger generation is so amazing in their ability to live in the gray. And, boys generally they act out in a more aggressive way with self-harm. They might punch walls, things like that, whereas girls might cut. But it's not an or.
Yeah. But don't boys need some guidance today on how to really sit within the space of their manhood?
Absolutely. Because
And
the
girls,
only socially sanctioned emotion they get to feel is anger, right? And
right,
that is such a tragedy for all of us.
right.
And they play more video games too, so they like self-medicate, they
With
zone
video games.
out. Yeah, there's more of that with boys. Yeah.
I understand what you're saying about teaching these kids emotional intelligence. Do you also do any classes or courses or guidance for parents themselves on how to help their children navigate these phases?
I do. And the brave parent will join my course, because this presentation, kids love it, and adults are sometimes, particularly intellectuals in the Bay Area, they're kind of like, whoa, with this. But she must be a doctor, so she's probably not crazy. But a lot of the parents take it, and then some of them have been parents of participants of mine. So now they have, both the kids and the parents have this language of dialectical behavior therapy where they can talk to each other in these emotionally intelligent ways. One of the modules is interpersonal effectiveness. So for them to talk to each other in this way and grow from each other and tweak and teach each other is so fun to watch.
When my daughter was growing up, she was about, I think she was 11 or 12. And a woman that I had known years before was coming through town and was doing this mother-daughter seminar type thing.
Mhm.
And the mothers asked some basic questions of the daughters, and the daughters asked some basic questions of the mothers, and it was all very nice. A couple of years later, I was totally shocked to hear my daughter say, when we did that day, mommy, that seminar? I said, yeah. She said, that was the happiest day of my life.
Oh,
And I would never in a million years have thought that she would name that as the happiest day of her life. And to her, that was the day that we had communicated most deeply.
oh, that is,
So that told me a lot about the needs of my daughter, not just to talk to another professional, but how the professional helped us talk to each other.
yeah. Well, that's interesting because recently I got an 11-year-old, which I don't usually teach that young, and now I've had 2 or 3 more. So I think to catch a mother-daughter, that window at like 11, 12 before
Well,
they're 14, uh,
that's happening early
that
now, isn't it?
that could be a great, I mean, once things open up, we're going to be doing emotions camps
Yeah.
and teaching workshops. And that is a great idea to do, like middle school, 8th grade, 7th, 8th grade.
Yeah.
Yeah. That's just starting to percolate in my mind, that kind of a thing.
Just talking to you, I understand why you have the positive reputation that you have. Thank you very much for cluing us in, not only to your own work, but to things that all of us have to think about in terms of the crises of our kids today. Thank you so much. I so appreciate it.
You too, Marianne.